Hey there, everyone. Happy Monday. It's good to see you after a 3-day weekend that most of us really needed and appreciated in the middle of the COVID pandemic. So I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update on the effect of the COVID-19 pandemic on Mobile County and our residents. Around the globe, there have been more than 11.5 million cases of COVID-19 with over 535,000 deaths. In the United States, we're reaching 3 million cases with over 130,000 deaths. And in Alabama this morning, their dashboard was reporting 44,375 cases with 989 deaths. So the cases in Alabama continue to rise at an unprecedented rate, the highest numbers of cases that we have seen since we began keeping score on the COVID pandemic. Our Alabama first case was on March 13th, and Mobile County's first case was on March 19th. In our daily report, we're reporting this morning on 4,157. There were just a small number of cases added yesterday, but that was due to the long holiday weekend and some laboratories and businesses being closed. But on Friday, 103 cases were reported. On Saturday, 70, and then 40 yesterday. That number will go up. This morning I was on a call with the state, and they reported that they had nearly 9,000 lab results that were in queue needing to be worked on today. So, leading up until Friday, we had 7 of the 7 days within a 10-day frame where we had more than 100 cases added every day. We're still sticking around 300 hospitalized and 138 died. Again, we know that traditional public health surveillance is often behind those events occurring, and after someone gets sick, then it takes a few days until they need hospital care, and then from a hospital it takes days before they die. So there is sort of a natural lag in those events occurring after we hear about a case. But there's also sometimes a surveillance lag in that we don't always find out about those things the day that they happen. But we are hearing from our local hospitals and through the AIMS data that is available to us daily that the hospitals are beginning to see many more patients hospitalized with COVID than we had just a few weeks ago. I think 2-3 weeks ago, each day when I looked at the data, there may have been around 50 or 55 people hospitalized on any given day for COVID, and now it's getting upward toward the 90s. So I'll review just a little bit of information in our expanded report. Again, last week we saw 644 cases added in Mobile County residents. Those were community transmission, and then only 12 that we know of that were associated with a long-term care facility. So this was a 60% increase in cases over just the prior week. So you can see on this column chart with the number of cases that we are just seeing, an unprecedented rise in the number of cases. So, for those of you that have asked, are we in the second wave? We are not even close to the peak of the first wave. I began looking at the data just also by month, because again, you can see it much more dramatically that in March we had just a few cases, but in April, May, and June, just a steady, stepwise increase in the number of cases. So this is not looking like it's getting any better. And in fact, community transmission is widespread throughout Mobile County and our neighboring jurisdictions. Again, the reason that we continue to emphasize staying at home if you're sick, wearing a face covering if you go out, maintaining a 6-foot distance from anyone who's not in your immediate household, covering your cough, washing your hands, those sorts of things are the only thing that can slow the spread and flatten the curve. When we were at the stay-at-home order and everyone was really careful, and we were all working together to implement some of those prevention measures, we were able to keep the number of cases down and delay a spike in our community, which meant that we helped preserve the infrastructure of our healthcare system. We didn't overwhelm hospitals, We didn't overwhelm EMS. We didn't overwhelm medical examiners and funeral home directors. But now we're seeing a much more elevated spread. And so we continue to need your help to help us control the community transmission, and also make sure that our most vulnerable patients and family members and residents are not adversely affected. Those are the ones that are 50 and over or have any age of underlying medical conditions. So again, when you look at the age distribution, we are continuing to see the new cases mostly being in those young age categories in the 20s, 30s, 40s is what's driving that. We did add a few more cases in the 0 to 4 age group, and in fact we have 2 more patients who were 0 to 4 who were hospitalized since the last time I published this weekly report. The sex and race distributions aren't changing much. Those are staying about the same. But again, when you look at the trend by week, we just see this, enormous increase in the number of cases that are reported weekly. And, if you fit a line to this, it's just going to start going straight up. So this is not really looking good for our community. When you look at the 14 and the 7-day and 14-day average, for between April and around the middle of June, we had kept the number of cases on average reporting daily around, around 40, the 40 mark, and now we are up around the 80, the 75, 80, 85 mark that we are adding on average every day. So a doubling in just a matter of a couple of weeks. Again, take a look at the weekly report on this map. This map shows just the cases that were reported to us over the last 2 weeks, just to give you an idea about where our most recent cases are, where they live, where their residents are. You see a lot in the press about, this community transmission might be happening at workplaces, it might be happening at shopping centers, but we can only mark the cases by their home of residence. And so that's what we do in that map. And then another rather sort of surprising and alarming statistic for me is that on the last page of our report, where we plot the number of positive and negative test results that are reported to us, again, we see a slight decrease, and that may be a lag in report. So when we see those 9,000 get unstuck at Montgomery, then this will fill in. But the surprising thing is that the number of positive among all tests, the percent positive, went up to over 20% again. That had not happened since April 12th. So we are in an enormously concerning time for me and the public health leaders around the state, just at the sheer volume and of tests, of positive test results, and the speed at which this very infectious virus is moving around our community. So on to a couple of other things. Last week, the Alabama Department of Public Health issued a news release introducing a new tool that allows policymakers and others viewing it to recognize the COVID-19 risk status in each county and guide health behaviors. The new dashboard risk indicator dashboard is located on the ADPH website, alabamapublichealth.gov. If you've taken a look at that, then you will know the dashboard was just updated last Friday, and Mobile County is in the high risk category, very high risk category. And there are some infographics out there on what that means and what you should be doing. And based on this very high risk, this red status that Mobile County is in, really emphasizing these measures: maintaining social distancing, work at home if possible, if not, keep 6 foot from others, wear face coverings at work when social distancing is not possible, avoid all unnecessary travel. If you must travel, avoid crowded areas, avoid unnecessary visits to hospitals, nursing homes, or other residential care facilities, wear face coverings when social distancing is difficult to maintain, avoid groups of 20 or more, take out, pick up, or get delivery from restaurants rather than dining in, and when visiting friends or family, wear face coverings when within 6 feet of people outside of your household. And then the last one, hold online worship services if possible When meeting in person, keep 6-foot distances between people of different households. Consider holding more services for lower attendance and more spacing between people. So again, we will probably see this relaxation and tightening of recommendations and guidelines as we watch our outbreak evolve. When we had the protection of, public health advances under the safer at home order, the safe at home order, and then the safer at home order, that gave us this situation where we were able to keep the number of cases low. We could slow the spread of the transmission. But now that we have relaxed some of those guidelines, we can see the effect of that in this very obvious spike in the number of cases reported to us that are primarily due to community transmission in and around Mobile County. So please take a look at that, just to remind you of the things that you can do to protect yourself, protect your family, and protect your community. All right, one other piece of news that went out from CDC today, they released a health advisory, and I believe it's been reposted on our social media page, that their FDA is warning about hand sanitizer from a company called ESK Biochem, and that company out of Mexico has sold hand sanitizer that may contain methanol or a toxic alcohol as an active ingredient, and this can cause blindness or death when absorbed through the skin or when swallowed. So please, when you're out there purchasing new, hand-based sanitizer, alcohol-based hand sanitizer, look for one by the company ESK Biochem out of Mexico. And if you have any of that, you need to, seek medical attention if you've had an adverse reaction, but do not use that hand sanitizer. Just return it to the place that you bought it. All right, there's a whole lot of other, if you're a physician out there, there are a whole long list of other recommendations, so you may want to pick up that, but I just wanted to make sure that people need to check their cabinets and their desks and their surfaces where they've got hand sanitizer sitting around, and make sure that it's not made by ESK Biochem. All right, on to a few questions today. Most of these are around wearing a mask. We realize this is an unpopular decision for some people, but we hear many more thanks and kudos and finallys from the people who are happy that mandatory mask wearing has been enacted in most of our county, and that they now feel safer moving in and out of some of the facilities throughout the county. So one question here about how long do I think that it will take for us to know if the mask ordinance will make a difference in the numbers. It will take about 2 weeks. So 2 weeks is the incubation period for novel coronavirus, for SARS-CoV-2. And we started seeing a huge spike in the number of cases about 2 weeks after some of the restrictions were lifted. And if the advantage that we have by issuing a mandatory mask ordinance will be seen in about 2 weeks. But again, it's not likely to erase the number of cases, because again, it's just an added improvement in the social distancing that we've already been recommending. So if you can wear the mask, if you can stay 6 feet away, if you can stay at home, if you can work from home, wash your hands, disinfect, all of those things in combination will help try to flatten the curve, or to try to reduce the rapid transmission that we're seeing around our community. Let's see. Again, someone asking if the increased number of COVID cases in the past few weeks could be the second wave that is expected, and no, it is not the second wave. We are in our first wave of the COVID-19 pandemic in Mobile County. Yes, you still have to stay 6 feet apart, even if you're wearing a mask. For a PCR test result to come back, it depends on many factors. One, I did hear from the state public health lab this morning that they are able to maintain right now their commitment to returning results within 72 hours. I have heard that there are some private laboratories that are stretching beyond that. Certainly we are seeing that in our facility, that it's taking quite a bit longer from one or two of the commercial laboratories, but I believe they're working. I think it's a supply chain issue, and I'm sure that they're working on that. Let's see. Someone asking kind of an interesting question. How does Mchd conduct data quality on the daily statistics report? In other words, how do we know that our daily infection, hospitalization, mortality reports are free from error? We do our best. We try to automate things to the greatest extent possible. We try to have second sources validate our reports to make sure that what they see when they run the daily statistics reports are the same things that we see. We do make errors from time to time. I have admitted this in the past. We're working under a fever pitch as hard as we can, and just even moving numbers from one automated program over to a Word document is prone to human error, and it happens sometimes. What we try to do is be extremely responsive to those when someone notices. We're very open to hearing from you. If you notice an error, please let us know. If you question the data, if it doesn't look quite right to you, please let us know, and I'm happy to look into it, because I could use your help out there as well, just keeping an eye. We want things to be as accurate as they can be, but there's this term that I've learned as a career CDC employee, responding to outbreak after outbreak after outbreak, and tons of hurricanes and earthquakes, and all of several different continents. And anytime there's a disaster, the math is never going to add up. And so I started calling this years ago, referring to it as disaster math. That everyone's clamoring to get how many people are affected by the hurricane, how many don't have power, who died, clamoring for that information, and it comes from everywhere. And in the first few days and weeks of any event, it's really bad, because it's disaster math and there is nothing precise about it. By the time we get weeks and months into an event, we try to do our best to make sure that the math is as accurate as it can be through automation and checks. But we still there still can be errors, so we're happy to correct ourselves when we make a mistake. All right, and then the last question about, once you've had COVID-19, can you get it again? Most people are saying that you will have some immunity after your first time with COVID-19, but no one is really ready to say how long that immunity lasts or how well it might protect you against a second exposure to the virus. So I don't think that the numbers going up right now are reinfections. These are people that have not been infected before, so new names that we're seeing. We do know that people can test positive, for weeks sometimes after they're symptomatic, but this is just viral shedding. So we will continue to pay attention to the data and see what scientific information is being published to help us understand. And as soon as I see something that's that has more science and data behind it, I'm happy to provide that information to you. But like I said, right now, CDC and their other federal partners just are not sure how much immunity is provided by an initial infection or how long that immunity may last. I'm going to see if there are any questions from Facebook that I need to address today. All right. So at some point in this process, we will sort of slow down the times that we come before you to give you an update. Now we're committed to still doing it weekly. For a while, it's extraordinarily taxing on all of us, but we definitely will be continuing to put out our daily report. Our weekly expanded report will come out each Monday, and we'll likely see you again tomorrow at 2:30. Thank you.